Ella Kate Marisi, and you are listening to More Than Child's Play with your host, my mommy, Lacey Marisi, and my Aunt Nicole Surgeon. They are authors, therapists, and most importantly, mommies. And man, can they talk. So sit back and relax and learn from their village. We hope you enjoy the show.
Hello, welcome to the More Than Child's Play podcast. This is your host, Nicole Surgeon. I am flying solo today. My co-host, Lacey Marisi, is on vacation. It is actually her birthday today, so we're going to give a shout out to her and hope she is having a nice day. We are so excited to get back to podcasting after a little break this season. Everything seems to have been on a break, and we did have a bit of a hiatus with the coronavirus, as most things have been on pause. In that vein, we are thrilled. I am thrilled, and I know Lacey is too, even though she's not here, to welcome a dear friend and esteemed professional, Dr. Lisa Costello. I'm going to take a minute just to tell you a little bit about Lisa. Her bio and her accomplishments are long and wide, but I'm going to hit some highlights for our audience today. Lisa is a lifelong West Virginian. She is actually from my hometown, Weirton, West Virginia. She is an assistant professor in the Department of Pediatrics at West Virginia University in Morgantown, West Virginia, which is also our shared alma mater with Lacey and I. She's a pediatric hospitalist at WVU Medicine Children's Hospital and the co-director of the pediatrics clerkship. She leads a healthcare literacy and patient advocacy curriculum thread for the medical department. Program, and is the advisor for the medical student group, Student Advocates Impacting Decisions on Healthcare. While at WVU, I thought I loved the university. Lacey loved the university. There's probably not a bigger supporter of our state and especially our university than Lisa. She is a huge fan and advocate for our region. She played on the women's basketball team. She won WVU's prestigious Miss Mountaineer Award. She was a distinguished Mountaineer, named that by then Governor Joe Manchin. She has won all sorts of awards, including being selected into the Gold Humanism Honor Society and the School of Medicine's Alumni Association's President's Young Alumnus Award. Lisa is very active in the university and the pediatric department. Her background also includes public health. She does a lot with the medical school. She currently serves as the president of West Virginia University's chapter of the American Academy of Pediatrics. She's the treasurer of the West Virginia State Medical Association, the vice chair of WESPAC, and board of directors for the WVU Children's Health Insurance, not WVU, but West Virginia's Children's Health Insurance Program. She has quite a presence nationally as well and is a member of the American Academy of Pediatrics Committee on State and Government Affairs. She is on the executive council for WVU School of Medicine Alumni Association and has won several past awards. Lisa very actively engages academically with advocacy, healthcare policy, social media, and improving communication with patients and healthcare professionals, as well as engaging with the public by utilizing technology and media to amplify advocacy and education. She's very active on social media on behalf of children and their health, and so we will give you contact information for that as well. Interestingly and important to our conversation, most recently she has served and supported the Bureau of Public Health during this pandemic response for our state. Personally, Lisa is a friend of our family. She is younger than your host today. And when we were growing up, she was a neighbor of my grandparents. And even at a young age, would come and sit on the porch with my grandmother while my grandfather was going through a very terrible illness. And from a young age, it was very clear that Lisa had a heart for patients and for caregivers. And that has certainly been true throughout her life. So, Lisa, that was a big intro, but welcome.
Well, thank you so much for having me. That is quite the introduction, and I appreciate that. And I could spend just as much time, even longer, giving accolades to you and Lacey. And I'm just really excited to be here with you to chat about COVID and whatever else we want to get into. But I just really respect all the work that you and Lacey, therapists are some of my favorite people on this planet, whether it's physical therapists, speech, occupational, respiratory. I know that they have had a profound impact on my career and my personal life. I tell my physical therapist all the time that she's the best and that I literally wouldn't walk without her. So I just appreciate all the work that you and Lacey do on behalf of children and our community. So I'll share in giving a happy birthday shout out to Lacey, but just super thrilled to be here. Thanks for having me.
Thank you. So just a few housekeeping things before we get started. We are going to talk about coronavirus specifically today, including a lot of questions that our listeners contributed to this conversation. This is a podcast on infection and public health and children and their general wellness and well-being. This is not a political conversation. We're not going to dive into that because we're healthcare professionals and we're here to talk about health. I told Lisa I don't even think this needs to be mentioned because our audience has historically been so warm and welcoming and encouraging, but it is 2020, and I'm just going to say that I will protect our space from any negative comments on any platform that we share this on social media. I really respect Lisa's opinion and her time, and I'm thankful for her being here. So I also wanted to thank our listeners. We had some great questions come in through social media, and I'm super excited to share them. So we're going to go ahead and just get started. And we're going to start with a general question. I want to ask you, Dr. Lisa, because we know this is a novel virus, and I want you to talk to a minute for us about what that means. Information seems to change quickly, and I'm wondering what you could share with us about why. As a physician who has worked in public health, can you explain to us why it seems like sometimes the message changes frequently? And from your end and your work in public health, how does the science around a pandemic like this work? What do we actually know about this virus as of today? And what do we know about how it affects children?
It's a great way to start off talking about coronavirus. And I'll probably use it interchangeably, but we're talking about a virus here. The virus name is SARS-CoV-2. And it's frequently referred to as COVID-19. That's actually the disease caused by the virus. But when we're talking about this novel virus, that means it's new. From what we can tell, it was first identified in late 2019 in China. And we know that there are coronaviruses that have exist. There are many different human coronaviruses. There are also many hundreds actually of coronaviruses that impact animals. And there are times that can what we call spill over into and cause disease in humans. And that's what we're seeing with this novel coronavirus, SARS-CoV-2. So it's a new virus, meaning we're learning a lot about it. We're learning about how it spreads, how long it takes a person to develop symptoms, how long they may be considered infectious or that they could share or spread the virus. We're also learning a lot about the symptoms an individual may exhibit and also what impacts it has on the body. We have seen individuals get actually no symptoms or have very mild or moderate symptoms to people be very severely impacted by this disease. And we have unfortunately seen hundreds of thousands of deaths at this point from this virus. So when we're talking about studying it, we're learning more about it every day. So, we, at the beginning of this, and what we know in other pandemics, we try to institute measures that we know can help prevent spread of a virus or common infection control strategies. But I think we need to give respect to this virus and that it is new and it is unique. And we will always, I think, in human nature, try to compare it to other items or other viruses. But by and large, this should be treated as its own virus, and we're learning more about it. And so I think that can sometimes be frustrating to the public. It's also frustrating to healthcare professionals because we want to know everything. We want to know answers yesterday. But when we're dealing with something new, it takes us time to study how it's impacting others, particularly when we're talking about these long-term effects on individuals. We'll have to see, we've only been identifying this virus since the end of 2019. So we're learning more and more about it and learning more about treatments that can be effective in managing it, learning more about how it spreads and ways that we can hopefully reduce that spread. And so it can be frustrating to hear these different changes and recommendations, but that's a good thing. That means that we're studying it. We're looking at different aspects of the virus, whether it's spread or impact on individuals of different ages and what treatments might be beneficial. And we want to improve our treatment. In medicine and healthcare, we always talk about quality improvement. That's the work that we need to do. So even if we feel like we have something under good control, we need to be looking at ways that we can always consistently improve. And that's certainly the case here in a pandemic. So as time goes on, we'll be able to study more when we look back on impacts, but then also moving forward. And in science, we talk about, or medicine, we talk about a randomized controlled trial, notably a blinded randomized controlled trial being the gold standard of when we're studying or recommending treatments. And those take time. You have to recruit participants whether you're talking about a medicine or a drug. You have to go over the risks of being in that study and then perform the study and collect data over a period of time and then analyze that data and then review that data and do a peer review process so that we can be working with evidence that is accurate and been reviewed and looked at in multiple different lenses so that we can draw conclusions from that. And I think, in healthcare, we take in medicine an oath to first do no harm, and we're certainly wanting to abide by that as well. And so we have to look at all these different studies and interpret them and what they mean. And it is certainly rapidly changing as we're learning more and more and more about this virus. So what we're going to talk about today is based upon what we currently know best. Things can change. And from the beginning of this, when we've really been addressing it in the United States, or in West Virginia since around March, there certainly have been items that have changed. But I think that can, and that should be viewed as a positive thing because we're learning and we're growing and trying to provide the best care and recommendations available with what we know best, learning from what we've seen happen, and then also looking at how we're going to move forward.
That's wonderful. Good information to have. I'm just curious too, can you talk a minute about children? What do we know right now about how this virus affects children and how that may or may not be different than how it affects adults?
I always like to say as a pediatrician, children are not little adults. I'm actually trained in internal medicine as well as pediatrics. And so I've had the opportunity to care for adults in my past work. I now solely care for children. Obviously, in my public health work, I'm helping to make policy or input and recommendations for people of all ages. But what we can know now about children is that by and large, they tend to have milder symptoms if they contract COVID. So certainly children can get COVID-19. We have seen in other countries as well as our own that they still seem to get it less than comparatively to older individuals. And if they do get the virus, it tends to be less severe, meaning they have mild or moderate symptoms. Common symptoms include fever, cough, runny nose, but also we've seen a lot of GI type symptoms, so nausea, diarrhea, upset stomach. And then interestingly, a lot of individuals have reported kind of a loss of taste or smell, which it may be associated with kind of the nasal congestion. So we have seen kind of a broad array of symptoms that can impact individuals. And by and large, children seem to get the disease in milder forms that could be really subtle. But we are seeing individuals, children, get more severe disease and end up in the hospital. We've seen that at our hospital in Morgantown, and we've seen that in hospitals across the state, that children do and times need to be admitted to get care inside the hospital from COVID. And then also we've seen children unfortunately die from COVID. We still, in the United States, have seen less than 100 deaths from the most recent data that I've seen when it comes to children. But certainly, for those families and for anyone that's lost someone or had someone impacted by COVID, that's obviously a very traumatic and challenging and difficult thing. And so we know that children can get it. Fortunately, we still think that they tend to get it more mild, but we are seeing children get it severe enough that they end up in the hospital. And as we've done more testing, just of recent time, we've seen a big uptick in more children testing positive. Now, there's many things that could contribute to that. Maybe they've been out and about in the community. There's more access to testing, so they're getting tested more. They've been identified as a contact of a case, so they're getting tested in that regard. So we have seen an uptick in children testing positive. And then, we've talked about the severe complications that some could have. One of them is called this MISC, or multi-system inflammatory syndrome in children. And it's really this inflammatory response that we see that impacts multiple parts of our body: our heart, our lungs, our kidneys, can have skin as well as GI. It's a big inflammatory response. We can see that in other, some people compare it to this disease called Kawasaki disease. So we can see that be triggered from any virus really, but there has been this association with this MISC in children. And that is a more severe manifestation or consequence of the SARS-CoV-2, and usually requires hospitalization. And fortunately, if it's recognized and treated, we've seen children do well or be able to recover from that, but it certainly is a serious illness. And so we're learning more, and we continue to look at children, how often they test positive, how often they spread the disease, and then how often they're ending up in the hospital, and what happens when they're in the hospital, how severe their illness is.
That's great information and really important. My next series of questions for you that came from our listeners center a lot around activities and interactions. And I know as a parent myself, I've read different authors who sort of joke about, we are the generation of parents who want the handbook. How do we do this right? We are overachieving parents. One of my favorite authors says that her parents say, your generation made parenting a verb, and we didn't parent you. We were just your parents. And I understand that because I have felt that pressure as a parent. It was part of the reason why we started our business, to remind people to let children be children. But in the same respect, I do think we have a generation of parents who just want to do it right. They desperately want to keep their children safe, and safe in many fronts, not just physically, but mentally. And it is as you know, a very hard situation where there doesn't ever feel like there's a right answer. There's maybe just an answer or a choice that's a little better than the opposite. So I was not surprised to see that when we asked for questions from our listeners, a lot of them centered around activities. And so I'm going to ask you a few of our listeners' questions. Starting with the first, who was from a parent whose child is a micropreemie. So this might become two questions because a lot of our audience parent children with special healthcare needs, and so their concerns are even more heightened. But in general, I've heard this question a lot: when will my child be safe to go into a small size Sunday school classroom? And so I think this is a great question for children who don't have remarkable health histories, but also are higher risk kids. What are your thoughts on that?
This is a great discussion to be having. I'll say this, as a whole, and I'll probably sound a little bit like a broken record. Although, do they even say that anymore? Since there's not really records, I guess. Do I sound like I'm?
I still say it. I don't know if anybody else does.
Maybe I'm just stuck on my Spotify song. I don't know. That's going to be the new vernacular. But I'll probably repeat this a lot. Whenever we're talking about really any of the recommendations that we're setting forth, we're really talking about how do we mitigate risk. It's really hard to completely eliminate any risk, but I think that's with anything in life. I'm not a parent yet, God willing, maybe one day I will be, but I'm a godparent, and I have obviously a lot of children and teens that in my personal life are really important to me, as well as all the children and teens and families that I have the true privilege to get to care for as a pediatrician. And so, these are tough decisions. I can empathize with that. It's really hard and to like you said, be a parent and make these decisions. And really, it's anything in life. Everything we do in life has risks. And when it comes to this pandemic, certainly that's been even further highlighted, where we can get this sense of every decision I'm going to make has consequence. And so I think when we're talking about this, we're going to talk a lot about we're going to try to mitigate the risk, but it's hard to completely eliminate the risk. And you could still do everything right, and your child or your loved one could still potentially contract the virus. And I don't say that to be scary. I just say that, I think we have to be a little bit kind to ourselves when we're making these decisions and say, I'm taking everything into consideration. I'm going to make the best decision for my family. And so when it gets to your specific question about the micropreemie, we do and have seen certain medical conditions put people at increased risk of severe illness. So we talked a little bit ago about, what are the symptoms and, who gets it really severely ill. And it's hard to absolutely predict, but what we know is that there are some people that have certain conditions that do place them at an increased risk of getting that severe illness, which would potentially land them in the hospital. So cancer, kidney disease, lung disease, if you have a weakened immune system, say you've had like an organ transplanted. We also have seen individuals who have obesity or have a BMI of 30 or higher, a body mass index of 30 or higher, diabetes, individuals who have serious heart conditions. And then also we've seen severe illness in individuals who have sickle cell disease. And so those are ones that we see, that have had an increased risk. There's other diseases, and we're learning more and more. Just recently, there was a study, particularly in teenagers, since we're talking about kids and teens, that if those who vape, which is terrible, don't vape, please, anyone of any age, but particularly children and teens, there might be an increased risk of getting COVID from those individuals who also vape, and they could potentially have more serious disease from, making that association. So
as the parent of teenagers, thank you for the shout out for not vaping. I think anytime we can mention that in any context, it's a good thing.
Yeah. We'll definitely be talking about, as a pediatrician, I'll be talking about don't vape and vaccinate your kids. Those will be my two things that I'll certainly be able to weave in. But I think it depends. It's hard in a situation like this. I don't want to this is certainly a complex area. And I always encourage individuals to talk with their healthcare professional. But, if just being a micropreemie alone, if they're doing fine now, their risk might be just like anybody else in regards to if they would potentially get severe illness. Obviously, if they have heart disease or lung disease, if they have lung challenges, which sometimes micropreemies have lung challenges for their life just because of lung development, then that would potentially put them at an increased risk for severe disease. And so you have to kind of look at your individual situation of what risk factors, you have individually or your kids have, and then those around you, kind of what your risk factors are when you're trying to weigh into what type of activities or settings you're going to be willing to go engage in, what type of activities you're willing to do.
And I think it's important to remind parents to talk to their pediatrician about their individual child's health issues. I know I've had several patients during the last few months where, depending on the child and depending on their health history, the answer has been, yes, I think if you wear a mask and the people around you are wearing a mask, that child is okay. And then I've had other children where the pediatrician has said, even to the extreme of, going to a lab to get that annual blood work isn't essential right now. We can wait on that. And really being very cautious based on health history. So yes, good reminder for that. Okay, next question. We have a lot of questions, and this is common. I've heard this a lot too. Indoor sports, outdoor sports. The first specific question is, our son is 1 out of 4 kids in a Taekwondo class, and one parent refuses to wear a mask. She sits in the room with the other kids, and also her son doesn't wear a mask. Is he safe in this environment?
Sports certainly has a profound impact in children. It has in my life. You mentioned that I played basketball. Fortunately, your grandparents and your entire family are wonderful, so they didn't care that I was out bouncing a ball outside of their house for hours upon hours. But, we know that sports have a significant impact on children and families. Exercise is important, and we should be encouraging exercise even if we have to remain physically distant. But when we're talking about sports, it really comes down to, and we'll talk about this again, it's going to come down to where you live and what sport you're talking about. So there are certain sports that may have a higher risk. Obviously, if you're, how many players are there, what's spacing, how often or for how long are they in contact? Is this an indoor versus an outdoor sport? If it is an indoor, how big is the facility? How well, is it ventilated? That can impact the risk of an infection. So when we're talking about kind of mitigating this risk, because as we discussed before, for what we know now, children seem to get the infection less. And if they do get it, they get it with less severe consequences. But we are learning more about it. So we have seen, children get it and spread it even within, a sports team. Or recently there was a camp in Georgia where there was kind of spread. And so I think it depends upon, again, what is the sport? And it goes back to what are the risks versus the benefits? So if you have a child that has those underlying conditions, they're immunocompromised or they have a history of diabetes, then that might be a little bit of an increased risk, and really need to be having discussions with the school or the league of what's the policies, so we haven't talked a lot about this yet, but I'm going to say this a lot throughout, hand washing is really, really important. Maintaining that physical distance of at least 6 feet when we can, wearing a face cloth covering, not when you're actually playing the sport, per se, but maybe when you're like on the sidelines or when you arrive at practice or when you're leaving for practice. And then, really it's going to take each and every one of us. If your child or you and your family are having symptoms and you feel sick, then they should not go to participate. That can be a little bit challenging because we talked earlier about how a lot of individuals don't have symptoms at all. So it can be hard, or their symptoms might be so mild. But if you know that your child is sick, then certainly we need to keep them from that sport. I know when I played, I always wanted to go no matter what. I didn't, even if I had a sore throat, like it was going to be hard to keep me from practicing. But I think we have to really work together as a team and say, you're not feeling well, so we can't go to potentially risk others from getting, whatever you may have, and then have that discussion with your pediatrician if you're sick. So I think it's ultimately going to fall to the parents or the guardian to decide if they participate. But I think if places are taking action, it sounds like in the question you asked, most people were wearing masks and staying like physically distanced. I think if you engage in good hand washing, then you potentially could do that safely because you're not potentially in contact with other individuals as much. But again, I think I'll probably use a lot of sports analogies, but we can draw up the play, but we have to all run it. So if people don't follow the guidelines or the recommendations, follow the rules, then it makes it a little bit more challenging because then there might be spread in that setting.
And our next question was about gymnastics. Is it safe to go to gymnastics? And so I can see like this could go, is it safe to go to baseball? Is it safe to go to soccer? Am I hearing you right that what you're saying is the important things are frequent hand washing, the majority of people wearing masks absolutely when they can, and the distancing and proper ventilation? Those are like the factors we should be considering when we're making our best decisions.
Correct. Like, are they cleaning like frequently touched areas? So in gymnastics, mats, right, bars. So I'm not saying after every person participates, but at least daily you should be doing a good cleaning and maybe not using the water fountain. Although if there is a water fountain, just making sure that it's clean. But I would probably maybe discourage that practice and making sure that there's water bottles. That's for other viruses as well. Just to try to minimize again that interaction or that close interaction, and maybe limiting like locker rooms or
lobbies
like lobbies or places that people would typically congregate, and maybe stay a little bit more separated, particularly if you can avoid them altogether. They're really, really small places, but kind of taking those prevention measures into account to help again reduce the risk. And just to be clear, like athletes don't share food or drink. I would argue that's at any time, but because we can share other viruses as well, not just SARS-CoV-2. There's the other viruses are still out there, for teens, mono, obviously when we get into the flu season, there's other viruses that are out there. And so, I think those points that you hit on are going to be the big ones. And at the end of the day, it's going to come with how comfortable that family feels and what their individual risks are, whether they feel like they can safely send their child to participate in that activity.
Right. So moving on again, just with interactions and like you said, what their risks are with their family, that often extends to extended families. And so I know so many families, ours included, are so missing grandmas and grandpas and cousins and new additions and special events. And it's hard, but when you love your family, you want to keep them safe. So we had several questions about family interactions. The first one involved a new baby. It is, if my kids are wearing masks and wash hands, can they hold their baby cousin who is 3 months even after they start school without me feeling like a nervous wreck?
I think we're going to have to definitely look at the individual kind of cases again. So, certainly want to be wearing masks and washing the hands. If you're potentially feeling sick, or if you notice your child has felt sick, then it's probably not best to let them do that. And then maybe we just have them hold or interact for a short period of time. Again, it's what risk, you're going to want to accept. And certainly there's positive benefits, and we've learned a lot. We're participating, we're practicing social distancing, we're participating, we're not physically in the same room, so we're using technology. So there's other ways to interact, to have those meaningful connections. And it is important to make sure that we're maintaining those relationships and those connections, because this is tough stuff that we're dealing with, and it causes a lot of stress on families and individuals. So we certainly want to make sure that we're staying connected. But we have to kind of, again, if the baby has some underlying medical conditions, like maybe they have some heart disease, then perhaps it would not be the safest to engage. But if the baby's been doing well, I think, you could consider maybe accepting that risk. But we haven't talked a lot about it yet. A lot of this comes into how much is the disease in your community. So if you're in an area where you're seeing a lot of disease, then there's certainly a higher risk of that community transmission. And so it is going to go on that case by case basis, but it is still recommended the best we can to, stay safer at home, to make sure you're maintaining that physical distance, not be congregating as what we're, I think, typically used to. But, I think if you reduce the amount of that interaction, there's still going to be that risk. But certainly wearing a mask, washing hands. Sometimes I recommend, maybe a towel or something to kind of separate as well. Then potentially
that's a good idea.
You could have that interaction, but there's still going to be risk. I think you just have to again, be very kind of truthful. People are like, oh, I'm just fine. I'm fine. You have to really make sure that you're being truthful with any symptoms that you might be having.
Right. And another baby question, someone wrote very honestly, what risks are worth it? My family is dying to spend time with my 9-month-old while she's still a baby. We currently only do outdoor visits at 6 feet apart. In the Texas heat, these visits don't last very long. Any thoughts? You did a really good job explaining about babies and some suggestions for visiting with babies, indoor, outdoor. Any thoughts on indoor, outdoor family gatherings?
Certainly outdoor is favorable because there's more ventilation, there's more space. And, we do kind of prefer outdoor. Obviously, when you want to be safe, you don't want individuals getting overheated, particularly if they're in it's hot in most areas this time of year in the summer, but particularly in some other parts of the United States, it's hotter. So, I think it's up to an individual person of what they feel the risks are worth it and what they're willing to accept. Because as I had mentioned before, people can do everything that's right and still potentially contract the virus. I see this all the time. I mean, in the inpatient setting, when kids are admitted to the hospital, more times than not, parents will say, what could I have done to prevent this? What could I have done? And there are certain things, obviously wearing a seatbelt in a car, making sure a child is properly restrained, in a car, or, firearm injury prevention and preventing injuries like that, or drowning prevention. There are certain things that we try to prevent, but accidents still happen. And when it comes to infections, you can do everything right, wash your hands, follow all the steps, and still potentially contract the virus. So, I think you have to look at your individual case and determine what you're willing to accept until really we have a vaccine, which we've been mentioned a little bit, but really, until we feel that we've been able to provide more immunity protection in kind of the community to really prevent this disease from being transmitted. That's really when I think the risk is going to feel a lot safer for a lot of us. But it does certainly impact, how much disease you're seeing in your community. If you're seeing a lot of spikes up in disease and you're having a lot of community transmission, I think it's probably safer to stay at home and not engage in those type of activities until you see less spread.
Let's talk about grandparents for a second. I have heard so many people say, I'm not sending my kids back to school. We're doing virtual because I want them to be able to spend time with their grandparents. Or I am sending my children back to school, and that was such a hard decision because I think it's right for their education, but we will not see their grandparents, or we will not see their grandparents indoors until we see how this goes. What would you say to families? Because I know there are a lot struggling with that, mine included. My parents have some health history. My mother-in-law is recovering and thankfully in remission from cancer. What do you say to parents who are wondering about grandparent visits, and especially grandparent visits and time spent indoors or outdoors after school has started?
I wish there was just like an easy one sentence answer. These are tough decisions. I think it's going to go back to playing into, what are those risk factors? How can everybody maintain their physical distancing and we can wear a mask, making sure we're all washing our hands. Again, it depends upon that individual's, underlying how they're doing in their health status and what risks they may have. Balancing that with the mental health, challenges that you might feel, from not being able to see your loved ones. And so I think the safer way to do it is, to be in that space, potentially outdoors, if you could swing it, and, maintaining that physical distancing versus making sure that you're wearing a mask around them, certainly, and potentially masking, making sure both people are masked. There are some people who can't wear masks because it might make it harder for them to breathe, or they have an underlying condition, and really good hand washing and cleaning of surfaces. I think that those are strategies that you can deploy. Everyone's situation is different. Many people rely upon grandparents to help provide care.
Many grandparents are raising children.
Right. We see a significant amount of kinship care in our state of West Virginia. And so their grandparents are heavily involved. And so I think you, again, need to kind of take into account like what risk factors your family has, and also being truthful, who have you been around, who have you been interacting with? Kind of the blanket statement is certainly like the safest is to maintain that physical distance and potentially continue that distance apart until we have a more effective vaccine. But, if you want to accept some of that risk, being thoughtful and maybe doing a little bit of a shorter visit, and then making sure that the area is really well cleaned, before and after, and ventilated, and making sure people wash their hands. There's been newer reports out, even in multi-generational households, in areas where there's community spread, maybe even wearing a mask at home. Typically, we've told people, in your own home, you wouldn't necessarily need to wear a mask, but, there is some discussion. Dr. Birx, one of the national leaders in coronavirus, they've started to mention that in multi-generational households, considering wearing masks,
to keep grandparents safe. Yeah,
to try to keep grandparents or those with any health, underlying health conditions safe.
So while we're on the topic of masks, we had a lot of mask questions. One specific, which this is a good example of a practical scenario. This question was, let me find this here. This question was, if 3 people are in a meeting, one person's wearing a cloth mask, one person is wearing a surgical mask, and one person with active symptoms and a positive COVID test, which I don't know why they were even there, but is wearing a surgical mask, and all are within 3 feet of each other for less than 30 minutes, would we consider those 2 others without COVID exposed?
When we're talking about close contacts, that's when we kind of talk about if you're in close contact with the case, those individuals, even though they're wearing a mask, it might be a lower risk exposure, but a close contact, this is from the CDC, is an individual who's been within 6 feet of an infected person for at least 15 minutes. And we kind of go from 2 days before the illness onset, or 2 days prior to when they may have tested positive, because we're seeing a lot of what we call pre-symptomatic or asymptomatic spread. Or pre-symptomatic spread is like, you were probably spreading the virus before you developed symptoms. And so, when we're talking about if you're identified as a contact, that is part of the public health investigation. When someone tests positive, they're deemed a case, and the local health department engages in case investigation to identify contacts, and those contacts are identified and then recommended to quarantine and given education on what are possible symptoms, and if they develop symptoms, they should get tested. And so, depending upon where the setting was, again, were you outside, were you inside? But in that particular example, because of the time, and since they were close to one another, even though they were all wearing masks, I would see individuals still considering that being a contact. With the caveat, healthcare settings sometimes are considered a little bit different because we are dealing with a crisis. And so we are seeing there are things that we do kind of during normal times, and then there are things in crisis situations that we, it's not ideal, but we accept that risk when we've talked a lot about risk and benefits today. And so this is a decision that really should be made in discussion with the local health department. But the scenario that you gave me, without knowing any more, I would probably deem that as a contact and as an exposure. And there are low risk and higher risk exposures.
Right.
And so, again, I think if you're being super, super cautious, I would recommend like quarantining, monitoring the symptoms. But again, that's a discussion that has to take place with the local health department.
Never have I learned more about local health departments or been thankful for them in the last few months. They're doing important work. So what about children 2 and under who can't wear a mask? How safe are they to go to appointments, medical in nature? This parent bought their child a face shield. Their daughter is 2 years old. Is that enough? Or should she even bother with a face shield? I actually saw a picture of this. It was quite creative. I don't know if it's helpful, but it was kind of like a kid's sun hat that had a face shield in front. Is there any benefit to that?
So this is a great question. I know that there's been a lot about, masks wearing in children, and the AAP, or the American Academy of Pediatrics, of which I'm fortunate to serve as the president of our West Virginia chapter here in West Virginia. We recommend anyone above 2 really wear that cloth face covering. I think younger than that, we worry about the potential risk of suffocation. And so that's why it's not recommended. There are creative kind of face shields. I would, again, it depends. You just want to make sure that they're going to be able to have proper ventilation. I think that, focusing more on, perhaps like making sure that you're cleaning your hands. So if you have like baby wipes or something, just because, kids love to touch things. And so maybe spending your effort instead of potentially getting them to wear the face shield. I mean, if they'll wear it, great. I would not recommend wearing the face cloth covering in less than 2. And so I haven't seen this area. It's not something that we have necessarily recommended, and we're again learning more and more about it. There's different types of masks that people have talked about. Just in the example you gave about surgical masks, there's like N95s or different cloth covering masks. We're learning more and more about what's more effective. What I've mostly seen is something that's kind of covering your face. Obviously, more levels, more layers potentially could prevent further spread, but you want to be able to make sure that you can breathe through them okay. Making sure they have a good, they're covering both the nose and the mouth. I think one of the biggest things that I've seen is individuals kind of like pull the mask down. So they pull it below their nose, or they pull it onto their chin. It doesn't help. It's a mask or a face cloth covering, we're trying to cover those parts of your face, not like a chin strap, Do
you have a suggestion for the type of mask that's best for children who are going back to school to wear? Any certain number of layers for the cloth masks? That was one of our questions, is if a parent is buying masks on their back to school list, Are there any certain cloth masks or certain number of layers that we should be looking for?
I don't have a recommendation of like particular layers. I think the biggest thing is we want to make sure that the size is right. So, I would recommend more so getting a child size one. So maybe smaller than what would be a typical adult. And so finding the right size, I think, is probably more important. And then making sure that they're able to breathe. So most, homemade or purchased cloth coverings, there's on the CDC website, there's recommendations as to what you can do. You can even make it with a bandana or a t-shirt. Again, the more layers that you have, the more potential decrease in the transmission of spreading that. And really wearing a mask for twofold to help prevent any of the spread and potentially protect us from getting exposure, but it really is one of those things that help others. And so I think when it comes to kids and mask, I think it's going to be really important to like practice with them. So this is not something that you're going to be able to do the night before. You have to really kind of condition them. And it's been interesting just that I've observed, whether I've been participating in a Zoom call with children or when I was recently on the inpatient service, like my whole team walked in and like the patient like just put her mask on. And I was like, good for you. Like I complimented on her. I was like, good job. And then she had a mask and we put the mask on the stuffed animal. So it kind of normalizes that. And if you're explaining, and it gives children a sense, this is a scary time for all of us, particularly children. And so having opportunities that children can feel like they're part of the solution. So, and giving them control over certain things. So maybe it's, picking the soap that they wash their hands or picking the song that they sing when they're washing their hands for 20 seconds. Or when it comes to cloth face coverings, letting them pick out the pattern that they might be wearing. And then, practicing with them, putting it on a stuffed animal and kind of normalizing that behavior. And then parents modeling that behavior. Right. I think that can be really, really helpful. And, I think it can be tough because I think, people, when they typically see someone wearing a mask or a cloth face covering, they might get stereotyped as they're being sick or something like that. So I think as more people wear face cloth coverings and it becomes more normal and it's explained that this is what we're doing right now to help us, in this, when we're talking about the virus, that is going to, I think, go a long way in getting individuals. So the selection of the mask is important, but I think it's more so going to be the behavioral components of making sure children feel comfortable.
I've seen some nice social stories too that we can link to, have kids watch videos or look at a book or, that tells a story of a character or a child who's making smart and kind choices with mask wearing. And I think especially for some children who may have learning challenges or challenges with social interactions, which obviously your mouth is a huge part of your social interactions, that may be helpful. And we can link that. I know I did a little bit of work in outpatient during the virus, and I work so much with babies, and I realized how much of my facial expressions are comforting to them or, motivating to them if I was trying to get them to do something. And I was like, I really have to be expressive with my eyes because I've lost my mouth and the ability to do that behind a mask. But we've all adjusted. Our next question is, and this is a good one too, if is washing your clothes as soon as you come home important, and showering? In this family's home, they make everybody strip down in the garage and head straight to the shower when they come home. Is that something you would suggest?
I think we want to be practicing good hygiene. Again, sometimes there's not, I'm not sure that this particular scenario has been studied. I think it depends upon, where you've been and what typically could be. I mean, I know that there were times, in my household after I had been playing sports all day, I wasn't going anywhere without taking off my dirty, muddy, softball uniform. So I think, we believe that this virus is pretty typically killed. It's a non-enveloped virus. So their CDC has recommendations as to what are products that can effectively kind of, when we're talking about cleaning and disinfecting. And so we think that normal laundering, for what we have proven thus far, normal laundering would work. It's important to also wash the face mask, because I've seen that too.
Yeah.
We've talked about the cloth face covering. I think that's a big point.
That's important to have like a dirty bin and a clean bin. So when you're leaving the house, you're pulling a clean mask, not the dirty one that you left in your car.
Correct. Yeah. So I think good hygiene is critical. And if you have been out and about, then perhaps, taking a shower and removing your clothes, I think that would be, helpful. If you went for, a 1-minute walk around your house and you come back in, do you maybe need to do that? I don't know if you necessarily need to go to that extreme. So
this was a practice with two parents in our household. My husband and I do home health care. We've been doing this for years, just to decrease the spread of any infection on our clothes after we've been at work. And I'm sure I probably err on the side of caution, but it's probably never a bad idea if you've been around a lot of people to change before you're sitting on your furniture and hugging your kids.
Right. Absolutely. And I think that's it. I think I've done some of those things as well too, before COVID, when I was on service during RSV season or flu season, even though I always get my flu shot, my husband gets his flu shot, just taking those extra steps to just make sure that you're practicing good hygiene, I think is important. And so, I think some of it goes,
you have time and you have water. It can't hurt.
Right. I think that's the case. I mean, everyone, and we'll probably talk about this a little bit when we talk about, I think we're going to talk about schools. Yes. I think every household is different and everyone has different needs. Not all the households are the same. And so, we've seen before the pandemic, just the impact that having like access to a washer and dryer can have on a family. And there's schools that kind of open up to allow that type of activity to happen. And so I think, I don't think it's going to necessarily hurt anything if you are practicing that, but it's not something that's been particularly studied to that level as
other things have been.
To make a strict recommendation. I think some of it comes with common sense.
Okay. General wellness question, and I love this one. Should I be giving children or taking myself anything to boost immunity?
So I think, there's a lot of information out there. I highly recommend people go to credible sources. There's not been anything found to necessarily be recommended. I think trying to do those things that keep us in good health at all times, practices that we would, try to employ, engaging in physical activity, eating a well-balanced diet. If you take a multivitamin, I think that's fine. Sometimes people will take, extra vitamin C. There's no specific kind of recommendation to kind of boost immunity. Believe me, I have seen a ton of stuff out there of people trying to sell items, but I think
elderberry, does elderberry work? Just outside of COVID, just general, that's always a discussion in our family.
Yeah, I think that, there's different properties that have like vitamin C, and we know like antioxidants, certainly I would just encourage individuals to kind of eat a well-balanced diet. And certainly everyone, again, has different situations. If you're found to have a deficiency in some type of vitamin, then it's likely going to be recommended that you take more of that. But I think, trying to do those practices that we do all the time, that
general
we really
care for yourself. Good.
Yeah, general care.
Lots of hydration, balanced diet, manage your stress.
Right. And I hope moving forward past the pandemic, people will institute some of these. I can't tell you how many people are like, I was washing my hands wrong the whole time. It's like, these should really be practices that we're doing all the time, whether we're in a pandemic or not.
Vitamin or magic supplement specific to coronavirus that we know about right now.
Correct.
Extra C. Okay. So this was an interesting question that came in from a colleague of mine who's an OT. And she said, I think I know the answer to this, but I'm just curious, Dr. Lisa's opinion. During this time of the pandemic when things are so stressful, can it be normal for older children to have a regression of behaviors to younger behaviors?
We can see in stressful situations, children or teens regress in their development. Certainly, I'm a big fan of all the work that you and Lacey do through Milestones and Miracles, and all the work that you do with development. I think that we can see that. So maybe you had a child who was potty trained, and then you might see them regress and not be in that. They might have episodes where they have some incontinence. Or certainly, as we progress, you might see older children maybe become a little bit more clingy, or also you could see them just become more isolated and kind of not be as interactive. Maybe they were a more outgoing person, and then you've seen over time them not be as interactive as much. So it is important to be checking in on, really people of all ages, but particularly children and teens to ask how they're doing, keeping an eye on, their behavior, that wouldn't be usual. So maybe they're more irritable, or they might be having more episodes of rage, or they have more conflicts than they typically would. I think it can be hard in the teenage years because, you have teenage daughters, so I will let you speak to that more than I could. But I think some of that, some of it might be normal teenage or adolescent behavior. But I think you do need to keep a close eye on that, because we've seen so much increased stress and anxiety around the pandemic. And so you certainly can see a regression in some of those developmental milestones from any stressful situation. And certainly we're seeing that with the pandemic as being a stressful situation. I would also just add here that, parents really model the way, or the adults, we talk about one caring adult in someone's life. And so I think it's important to have those guardians, those parents, the adults kind of set the tone. So by maintaining a positive attitude, like, we're going to get through this together. I know there's a lot of changes. I know it's frustrating. We can, if we stay consistent with that messaging that, better days are ahead. We're all in this together. We're going to keep talking about it and maintaining those open lines of communication, I think really go a long way in trying to make sure that we're checking in on everyone's physical and mental health as well.
Right. And we're going to go back to mental health here in a minute, but first let's go after the big one, which is schools. I'm sure you've gotten so many questions. I know she's been my own personal coronavirus czar to ask questions about schools. So I'm just going to go through the questions we did receive about schools. One listener asked, at what point should we as parents remove our children from school? And they specifically commented they weren't sure that they trusted the color-coded system that is proposed in our state, which every state's going to be different. But what sort of metrics, or should we, what should we be paying attention to when deciding whether to keep our children physically in school?
This is certainly a very hot topic, as it should be. This is important decisions. Schools are fundamental to child, teenage development, and overall well-being. And there's so much that comes from school, more than just the academic. There's social interaction. And there's also, for a lot of individuals, that's where it's kind of been our safety net. So whether that's food security or having that caring adult be there for the child. So certainly this is really, really tough decisions and important ones. And so the American Academy of Pediatrics, we did put guidance out, and really, the way that we advocate, and I've advocated for this, is that, when we're talking about policy considerations or what to do, really the goal should be to have students physically present in school. Virtual learning is great, but it is not the same as being physically present in school. With that being said, we have to have policies that are flexible, that can respond to new information. As we've talked about from the beginning, this is a new virus. We're learning more and more about it. That's a good thing. We need to keep learning about it. And we have to be willing, as a school, as a community, as an individual, to be willing to adapt. And so when we're talking about whether or not you should send your child back to school, it's again going to be a personal decision. You have to look at multiple factors. Talk to the school, get information of what type of infection control strategies are they going to deploy. Also, what is your own personal risk factors? Does your child or someone in your family have any of those higher risk conditions that you maybe feel uneasy about potentially sending them into an area where they're going to be around more individuals? Also, I think you have to look at what at home are you able to manage and care. Some people come from single families, and so it's really challenging for them to be able to provide care in addition to maintaining their livelihood of working. I'm not going to get into the debate. I mean, I think that certainly this pandemic has highlighted many of the inequities that we have in our communities. And so, certainly there needs to be a multifactorial kind of approach moving forward when we're talking about addressing some of these inequities. And it certainly is hard because we're magnifying all these inequities that we have in our society. And these are really tough decisions that have to be made. So I think when you're looking at making that decision, you need to see how much in your community is spread happening. And that's something that, the state Board of Education, as well as the local health departments are going to be taking into account, what is that community spread? Where is it spreading in a community? How many new cases are we seeing? I think that certainly plays into the decision as well. And the alerting system is designed for that, to kind of help identify, hey, we're seeing an uptick in cases. Do we need to be making changes to our mitigation strategies to try to reduce the spread? Right. So I certainly think it's a tough decision. I will say that whatever decision you make for your family is going to be the right decision that you make for your family. Everyone is going to have different situations. Not everyone home life is the same. Some people may be able to do virtual learning and they're able to make that work. There's a lot of other social benefits that come with school that, maybe you feel in your family it's worth that. And there's others that they need that school to kind of rely upon the multiple things that we talked about, whether it's food or access to broadband or access to electronic devices. I think the state is looking at
access to special education services and therapies. That's something that our community, I know, struggles with. And what is the reality for children who don't have another resource to access therapies? It's hard. It's, I empathize with all of these questions, and a lot of them as a parent I've had myself. I struggled till the very last minute till I had to make a decision, and neither decision felt right to me and still doesn't. And so I get it. I know why people are asking these questions. Specifically, someone said, what about if you had an underlying condition, specifically thyroid disorder or asthma, would you recommend virtual school over in-person school for those two diagnoses? Again, I'm sure they're going to have to talk to their pediatrician about their specific level of impact of both of those conditions. But are asthma and thyroid conditions something that you would worry about with in-person school?
Again, I think that, as you mentioned, this is something that you need to discuss with your pediatrician or your healthcare provider. Moderate to severe asthma might place you at an increased risk for severe illness from COVID. I'm not saying that you wouldn't potentially get COVID. A lot of times when I talk about this risk, we're talking about, what's your risk to get severe disease from COVID? And so if you have more severe asthma, and then the thyroid one is a tough one. It depends what type of thyroid disorder it is. If it's from an immunocompromised state, so say you're also on steroids or something, that would probably place you at a little bit of a higher risk. So again, I think it's really important to have this discussion with your healthcare professional so that they can give you some more of that individualized guidance.
Makes sense. What about if a parent has decided to send their child back to virtual school? Someone is asking, if I'm sending my child to virtual school, is it safe for them to play outside with neighborhood friends who are going back to school in person?
I will be honest, I struggle with this question. I mean, I think you have to, again, look at why are you not sending your child to school? If you're not sending your child to school because you feel the risk of them contracting the illness, whether it's for them, the potential to get severe disease, or there's someone in the household that they could potentially get severe disease, then I think your strategy should really be limiting interactions across the board. So you shouldn't be going out to eat. You shouldn't be going, you should be, obviously we have essential things that need to happen. And I certainly think going to your pediatrician and making sure you're updated on your vaccines and getting your checkups are essential. But, maybe there's other things that if you're really trying to minimize that risk of contracting the virus, because if you're playing with children, whether they went to school or not, you're potentially increasing that risk of transmission. And so when you're around somebody else that you haven't been around with, you're potentially being exposed to whatever they were exposed to, and if they contracted the virus. So I wish that was an easy yes/no question.
Makes sense, though. No, that information is helpful.
Yeah, I mean, I guess this is throwing it back. I mean, my mom, if I didn't go to school, I wasn't going out to play. I mean, that was obviously if I was feeling sick. I think this is a little bit of a different situation because we're talking about someone who's, choosing a different learning option. But, if yes, there might be more interaction with people in the school, but you're still going to be having that risk when you're interacting with other individuals that you might not interact with as much, especially if you're going to be doing so in a close proximity.
Right. I can't wait till a day until we have more absolutes, but until then, figuring out the risk and the value is just really important. Okay, last few questions, specifically about pediatrics. And adults, do we know much about the long-term effects of COVID on children or adults? What do we know about that at this point?
We are still learning more and more about this. As we said at the onset, this disease was first identified in late 2019. So we've really learned a great deal about the disease and the virus since that time, but we're learning more and we will continue to learn more. And when we're talking about long-term consequences, it's going to take time to determine if individuals have any heart impact. There was a study out of Germany that looked at individuals that had some cardiovascular or heart disease. Again, it's on an individual basis. And then you can speak to this more as a physical therapist, but if you get that severe illness, physical deconditioning that comes along with an illness, it can take time to recover from that. And so that's going to be different for each person, but certainly the physical deconditioning that can come along with a severe illness, people might bounce back at different times. And so we're still learning. I think the area of concern that we certainly want to make sure that we're looking at is what are the long-term developmental and mental health ramifications,
Right.
So stress, depression, we've seen in other disease states, kind of some trauma or PTSD, will there be that anxiety when it comes to this? I've already heard, from children of all ages, parents saying that of children saying, things aren't normal. They're never going to get back to be the same. And so there's certainly a lot of stress, anxiety, depression that we're seeing and those long-term impact.
We're going to talk about mental health in a second, but I just wondered, I've read and I've known a few people who have had COVID, that adults that then have trouble with mostly things that seem to hit the vascular system, blood pressure regulation, maybe pressure in the eye with some vision diagnoses, things like that. Are we seeing, or do you know, have we seen any sort of effect on the vascular system of children who have had it after they've regained health?
We're still learning, and I think there's still a lot of those studies that it's going to take time to really see if there's an association. We have to be careful, and I didn't talk about this. We have to be careful when we're talking about associations. Correlation does not equal causation. So just because we might see a correlation, it doesn't necessarily mean that was the cause. This is super tricky. And when we talk about interpreting stuff, really when you look at these studies, I think in this day and age, we read the headline. I'm a #pediatrician, so I'm engaged on Twitter. And people, will read headlines, but then when you actually look at the study and get into the nuances of it and you start to break it down, there's a lot more in the study than just maybe what a brief 4-minute read would yield. And so I think we have to learn a lot more, and we're going to need to be looking at that and then see would this have happened anyway, whether they got COVID or not. And that's where you get into those studies of that age and determining is this truly related to COVID. There certainly have been vascular events. So we've seen individuals get blood clots associated with the virus. And again, we continue to learn more. And I think that's one of the things that we have kind of learned more about it over time is the blood clotting and the vasculature, like you talked about, some of the consequences there. And so I think a little bit for that question, time is going to tell, depending upon what really are the long-term consequences. And it also depends upon what you had when you initially had that disease.
Good point. Okay, so let's circle back to mental health. We know the social emotional toll of this virus has been significant for all of us. Children are sadly not excluded from that. When you talk to parents, how are you advising them when they're worried about this aspect of the virus and how it affects their kids? How can we best monitor our children? How can we best balance that physical health and safety with mental health? I haven't talked to a parent since March who hasn't, to some level or degree, been worried about their kid's emotional state. What are your thoughts on this, and what can we do to protect our kids?
I think it's very important that we have this discussion about mental health. And for all of us, there's been stress, fear, I think a lot of uncertainty. I mean, I've heard so much like, just make a decision. Like, we just want to know, unfortunately, a lot of decisions are very complicated and there's a lot of different factors to consider, but all of that leads to stress. It really can wear anyone down. Certainly teens, I think I really, really worry about that adolescent, but really children of all ages. I think it's important that we are making sure that we are having open lines of communication and checking in with our children or our teen. And when we're talking to them, there's there's a lot of news coverage, media. We talked about that, social media. Really, we probably should be filtering a little bit of the information that children get, particularly based upon their age. So reassuring children, people are learning as much as they can about this virus as quickly as we can to try to keep everyone safe. We talked earlier about giving kids control. So what they can do, how they can wash their hands often and how wearing a face cloth covering, those are ways that could potentially help them be part of the solution. And then really watching and monitoring what their media consumption is. And so, there are frightening images that can be on TV, showing hospitals. And I've seen different images of, the more critically ill, intubated people that look really sick. And so, younger kids probably should be kept away from that. And older kids, it's important to talk about with them what they're seeing if they have that. And then watching for those signs of anxiety or depression. And so children, they might not be able to verbalize that. So they might not be able to tell you like, mommy or daddy, like I'm feeling nervous. But you might pick up on it in some of those developmental regressions that we talked about earlier. Or maybe they get more cranky, or they're more clingy, or they can't sleep as well, or they just seem really distracted. And that can really then say, hey, this is not normal behavior. Maybe I need to talk to my pediatrician, and then the pediatrician can screen for depression and anxiety and determine if they might need extra help, whether that's talking to a therapist or seeing a psychiatrist. But I think children and teens really like routine. So the more that we can stick to a routine, and then really being positive role models, like we talked about before, modeling good behavior, keeping a positive tone, I think is going to be really important. But
I know in the beginning of the pandemic, my kids, obviously, as we've moved into a little bit of a routine, their anxiety levels have leveled off. But in the beginning, it was such a shock to their system because from our end, there was, very little warning from their little worlds. They went to school and then they didn't. And everything stopped. And as busy teenagers, that was a shock to the system. And a few things that we did that helped were we have a giant chalkboard in our kitchen, and I wrote things like, have you gone on a walk today? Had enough water? Did something artistic? Just read a book, talked to a friend over the phone or FaceTime. That's one thing, teenagers do so much texting and messaging through social media, but have you, to the best way we can do now through a screen, which I'm not a fan of screens, but have you seen your friend's face so that you can see their emotions and expressions and they can see yours? Just doing our best to, like you said, establish a routine, but also make sure that they're building in breaks for things that I call fill your cup. Have you done things to fill your cup today? Because if you're not feeling good, there's a reason, and you need to figure out how to do that. And it was hard. It's still hard. Their anxiety about, well, what if we get switched to all virtual? And we've had to reassure them, well, then that will be a decision that's made for safety, and we will make the best of it. We will make you a school area. We will make sure that you're able to work on things with neighbors that we know have limited exposure as well, so that you will be with someone other than the four of us in this house, and you can work on assignments together. We'll set you up a school space. Well, just whatever to assure them that we'll take the punches as they come, and we'll make sure the best we can that you're safe, and we'll take it on as an adventure as we have to. It's hard. It's hard as a parent. And I think that the information that you shared here today, we're not going to know exactly what to do. There's always going to be a risk, but I know you've helped me personally, and I'm thankful that you've helped our listeners. Hopefully when you try to take the high emotions, which there are many, and stick to the facts about what we know keep us safe physically and mentally, it's easier to make the decisions, even though they're still hard.
Right. They certainly are hard. And I would be remiss, and I do, if I could just add this in when we're talking about mental health, is the whole concept of suicide. I know that a lot of times it's a tough thing to talk about. I don't think it potentially should be. Maybe we as a society have made it. But I think, not everyone will say they're considering suicide. And so, I do think that we just need to, be cognizant of that. And if it does get to the level where you feel like your teen or your child is getting to that point, that is something that needs to be taken very seriously. You need to make sure that you're reaching out to your healthcare professional. There are the National Suicide Prevention Lifeline. You can text to the crisis talk line. And then making sure that you keep your home safe, removing firearms, removing weapons, making sure that medicines are secured. As an inpatient hospitalist, meaning I take care of kids when they're admitted to the hospital. I mean, we do see children and teens who attempt suicide. And I think that it's really important that we talk about it. And I've heard it many a times, like people are like, oh, I didn't see it coming. And I don't say this to scare people, because I think we're all just trying to do the best that we can. It's more so just being prepared and making sure that we talk about it know that there's resources available to help in that situation. And so that's an important, I think distinction.
Too, assuring tweens and teens that they have it's well documented, it's well shared in the research that social media gives them the portrayal that everyone else is happy and everyone else is pretty and everyone else is popular and everyone else is athletic. And that's not the case. We're just not all gifted in all areas and we're not all happy every day. And so I think it's very important for parents to share the realities of this is really hard for me too. I miss my friends. I feel really sad today. And it's okay to feel those feelings. And this is what I'm going to do to make sure that I'm safe and that I'm okay.
Great point. Great point.
And allow them to feel their feelings, but also help them identify tools and activities and routines to monitor their own mental health and to improve their state of mind or their general sense of well-being to the best of their abilities, and to know when it's out of their control to do so and when they need more help. Because I know we have that conversation here a lot. You don't have to be okay all the time. It's not normal to be okay all the time, but we have to know what to do when we're not okay.
Yeah, I think the president of the American Academy of Pediatrics right now, Dr. Sally Goiza, she's a great mentor to me personally. I've worked with her nationally, and she kind of sent out an email. It's okay to not be okay. We've talked a lot about coronavirus. There's a lot of other things going on in our culture and our society right now that leads to a lot of uncertainty when we talk about social injustice and racial injustice, and there's a lot of stuff on the media. So I think the points you made are really spot on. It's okay to not be okay. It's just we need to make sure that we are providing the resources of support and knowing that there are resources available at a state level, at a national level, at a local level to help individuals cope through this together. We know that teens are impulsive. And so kids are curious, teens are impulsive. And so if they're feeling really sad, they might feel like there's no way out. And then they do something impulsively. And then they kind of regret that. And so if we can prevent that from happening, I think that's an important thing that we all consider as well.
Important, super important. Okay, so Dr. Lisa, at the end of every podcast, Lacey and I like to tell guests that the mic is theirs. You can say whatever you want. It can be funny, it can be serious, it can be educational. What do you want our listeners to know? It can be about coronavirus. It can be about something not coronavirus. It's yours. What do you want to say?
Well, I think I've obviously taken up a big mic or part of the mic. I think this has been an important discussion. Thank you again so much to Nicole, to Lacey for, doing this podcast, bringing into light, and for everyone that's listening. I guess what I would say is that, these are tough times, but as an optimist, I think that we're going to get through it together. Since this is the More Than Child's Play podcast, one of my favorite quotes, I think it was Dean Smith. I always had Pat Summitt say it in my basketball career, was, play hard, play smart, and play together. And I think, I don't know if it's so much, I think the play hard is like, these are hard times, just, going through day to day with all the changes, what we're learning, what we're seeing. It's hard times, but I think if we approach it in a smart way, using evidence-based recommendations, taking into account recommendations from trusted sources, whether that's the American Academy of Pediatrics, the CDC, it's good to ask questions, but we should be relying on science to help drive our decisions and our actions. And then we need to be playing together. This is tough. We're asking people, or public health is asking individuals to do things that maybe we haven't in the past. But if we do it together, help one another, washing hands, making sure that we're wearing a face cloth covering, abiding by these principles. And then when a vaccine that's going to be safe and effective is available, getting that and making sure that you're staying up to date on your other vaccines as well. Because they're incredibly important, and we want to be able to prevent the diseases that we can prevent. I think that's going to be really important, that we're remembering that we're in this together. So I guess I would say, play hard, play smart, play together. As you guys coined so well, play builds brain. So if we're all in this together, I think that we're going to get through it. And I'll just end with, I'm obviously a big Mountaineer fan, so let's go Mountaineers.
I love that. So listeners, Lisa is super active in social media. Any resources that she discussed here today, I will link for you in the show notes. that is with our podcast. I'll also put her social media accounts. She is great at sharing wonderful, evidence-based, positive resources for children and families. So you should absolutely go follow her. As a reminder, you can always get more information on the importance of keeping children healthy, happy, and smart through play through our website, milestonesandmiracles.com. We also have Facebook, Instagram, Twitter, and the podcast as well. 123 Just Play With Me is always sold on our website and Amazon and select retailers regionally, and makes a great gift for young families, for professionals who really believe in play as the best way to keep those kids healthy and happy and safe. Lisa, I am so blessed that you spent this time with us. You are such a cherished friend, such a gift to my family, such a gift to our state. We are so lucky to have you right now. I am so excited to share this with my friends, with my colleagues. I think this conversation, even though it was lengthy, is really, really important to keep people pointing in the direction we need to go to work together to tackle this. So thank you so much for being here.
Thanks for having me, and hopefully I can come back in the future and we'll be able to continue the discussion. But keep up the great work. Again, I'm a huge fan, and I appreciate everything that you do, Lacey, and the whole team just do for our community. So thank you. It's really been an honor.
Great. Thanks, everybody. That's all for now. See you next time.